Hello, my name is Renu Khanna and I belong to an organization called SAHAJ, Society for Health Alternatives. We are based in Vadodara in Gujarat. I've been working in the area of women's health for over 3 decades now in various capacities, in a number of training programs, as an action researcher, as an advocate for women's health and rights. As a feminist working in the area of health, we subscribe to a social determinants perspective on health, rejecting the solely biomedical paradigm. We believe that women's health is an outcome of her social, cultural, and economic status, and her lived realities and her experiences of her subjective experiences of her body are as important as the signs and symptoms which the biomedical system goes by. My experience of evaluation began in the 1990s when I was a director of a women's health program in Western India. Our program had to be evaluated and we were looking forward to the evaluation. Our entire team had several questions. We thought that the evaluation would guide us for the future, would build on the work that we had initiated in very trying circumstances. The evaluation, however, was deeply disappointing. We found that it was ahistorical, it was acontextual, it did not factor in the conditions under which the program was initiated, the context of the women in that area, the context and the nature of the NGO that we were part of. And we felt that we could not actually learn anything much from that evaluation which would guide us for the future. This then raised questions in my own head about how should evaluations actually be? What are the sort of values and principles that evaluations should be based on? I then began to think about the kinds of experiences and the questions and the stances that the evaluation should take vis-a-vis the implementing team. Who should be given primacy? Is it the donor or is it the implementing team? And in my perspective, I was very clear that the implementers who have been working very, very hard at realizing their objectives and goals should be the ones who should be at the center of any evaluation. So I began doing evaluations of health programs, and my aspiration was that every evaluation that I undertook should lead to some learning, reflection, and collective thinking on the part of the implementing teams. This is what I've been trying to do, and some of these learnings and experiences that I have gathered over the years is what I bring to you in this course along with our other colleagues and fellow travelers. Thank you, and we hope you will enjoy the course.